Good afternoon. My name is Doris Cox, and I'm the Executive Director here at Bay State Community Services. We are honored to be partnered with the Norfolk District Attorney's Office to address the complex issues that the individuals throughout our communities are dealing with substance use disorders. Bay State Community Services has been proudly providing substance use disorders and mental health services to the communities for the last 45 years, and we so look forward to working on this project. We greatly appreciate all the hard work, dedication, and really the innovative thinking of so many people in this room. We're able to offer this critical service at a very, very important time in individuals' lives. Thank you for being here with us today. We have a wonderful agenda. It is my pleasure to welcome Secretary Bennett, who will provide us with some more details. Thank you.
First, I'd like to recognize Senator O'Connor, Senator Timilty, Representative Ayers, the Mayor, Joe Sullivan from Braintree, Representative Murphy, and the Mayor from Weymouth, Bob Hedlund. The idea behind this program really revolves around the great work of police officers and the great work of Bay State in helping people. And the idea is that when someone is out on the street, in a lot of cases, what they need is not to be arrested. What they need is to get an opportunity to get services to address their issues with opiates. And so what has been come up with the legislature, with the mayors I mentioned, with Lieutenant Governor Polito, and with Governor Baker, is a program, a pilot program, where if someone, an individual, is seen by the police, and the reality is they could be placed under arrest, but instead they're put towards Bay State so they can get help. And as long as they complete the program that's going to give them that help, they don't get arrested. Because in the end, the idea always of public service is to help people. And I really appreciate the legislature and the legislators that are here, the police and Bay State, for making this program possible and putting forth the ideas of Governor Baker and Lieutenant Governor Polito. This program for me means a lot. When I first came out of being a prosecutor in the Suffolk DA's office, I opened up my law practice in Quincy. And like many defense attorneys, I didn't right away have clients, so I got on the CPCS list. And so one day I had a client, and he was charged with possession of Class A heroin. And his family was waiting upstairs, and they asked me to help get him into treatment. And I went downstairs to the lockup, and I asked him, I said, "Your father and mother want you in treatment?" And he said, no, I want to hit the streets. I want bail. And you're my lawyer. Get me out on bail. And I spent about 20 minutes trying to convince him to go into treatment. And then I went on to my next case. And I went up and I did a good job. And I got him bail when he walked out. I could have spent an hour and a half of my time. The next date was about 3 weeks out, and he didn't come back because he had overdosed on drugs. It's important when that person first gets an opportunity to come to court that what they get is treatment and not an arrest. And that's why something like this, a program like this, means a lot. I'm going to introduce District Attorney Mike Morrissey, because I know he feels the same way about treatment. And this program wouldn't be possible without DA Morrissey. But first, I'm going to introduce Lieutenant Governor Polito, because I want my job. When I came to work for Governor Baker and Lieutenant Governor Polito, one of the first things that they talked to me about was the opiate crisis. And from the beginning of their administration, that's been one of the primary focuses. And every day, every week we have a cabinet meeting, and one of the questions comes up to Secretary Sutters and comes up to me, what have you done? What have you done this week? And what are you going to do to address this crisis? And it's leadership like that that makes it possible to do programs like this. So, Lieutenant Governor Polito.
Mr. Secretary, you can have your job and introduce me all at once. That's all good. Thank you very much for your leadership. We, the governor and I and our entire team, appreciate the work that you do and your whole team. Many of them are here today. I want to also thank the mayors who are here, Headland and Sullivan, and I know that Mayor Koch has done a tremendous amount of work in this area, and want to thank him as well, and I know he'll be coming here as well, as introduce and recognize the good work of my colleagues in the legislature, the representatives and senators here. This is a team effort, and all of us know that we need to continue to work as a team and find every possible way of trying to reduce the amount of exposure, intervene wherever possible, and to give the amount of treatment and response necessary for people to get on a path to wellness. It is true, when we came into office, Governor Baker and I realized that this was an epidemic that we needed to get on very quickly. And we formed a group of professionals to advise us around what to do. Here we are more than 3 years later, and we now have information and data to be able to really talk to the public and to all the stakeholders about where Massachusetts really is day to day. But you don't really need to understand, like, look at those numbers. You just really need to have one of those conversations or one of those experiences like Secretary Bennett described. And if there are any family members here in this room, and also the law enforcement who are on the front lines that see and deal with this every day, if not once, multiple times a day, we all know that we need to do more. The numbers do say that what we are doing here in Massachusetts is helping us move in a good direction. Closing down that front door and reducing the amount of scripts and the amount of opiate pain medicine that's in the supply is clearly working. The amount of long-term treatment that people can receive in order to battle their addiction and live a life that's good and safe here in this Commonwealth is working. But we also know that on the law enforcement side, we need to give you more tools to work with. That's one of the reasons why we have filed a bill to go after the bad actors, go after the drug dealers who are pushing fentanyl and carfentanil, those synthetic substances, into our communities. The numbers from last year show that the deaths associated with opiates and heroin, 80% included a fentanyl component. So it's very important that we pass bills like that so that we can give all of our law enforcement teams more tools to work with to go after the bad actors, go after the dealers, the people who are pushing these drugs. So I look at this program today, and I'm very pleased to announce that we are granting $99,000 to Quincy, to Braintree, to Randolph, and to Weymouth. And this is what we have described as the Buyer's Diversion Program. The first grant was awarded to the City of Worcester, and they've been working on this now for a few months now and are seeing success. And it's all about the people who are involved in this effort. So I talked a little about the dealers and what we need to do to go after them, but this is an effort to go after the buyers. Now you think about this, about supply and demand, right? The more the dealers can push these drugs into the communities because they have buyers, then the supply and demand system works. But if we can go after the dealers and disrupt their ability to sell this stuff, that's one piece of this. But if we can also target the buyers and help them divert away from both the criminal justice system and the interest in buying drugs off the street, we will also disrupt this supply and demand dynamic that is pushing too much drugs into our communities throughout our Commonwealth. So that's why we've labeled this the Buyer's Diversion Program. Go after the person who's using these drugs, that is buying these drugs off the street corners in the communities and taking whatever they can get, not really knowing what the true content is of the drug that they are consuming. And help them at that point divert away with the talent from the law enforcement and the DA's office from the experience of buying drugs and into an experience of receiving the treatment that they need to get well. So to be able to combine the efforts of the district attorney's office, the police departments, and a provider of service is a triangle of effort that we feel will give the people in this community, the 4 communities here, a better chance of succeeding and combating their addiction and living a life of wellness and of fullness here in our Commonwealth. I want to thank all of you for coming forward with this idea. This is a pilot. This is another opportunity and a chance for us to do something that can better improve our success story here in Massachusetts. And it takes a willingness from the law enforcement community, who are typically trained to go after illegal activities and prosecute for this and create a criminal record and create a police report. So this is a different mindset that these men and women in uniform bring to this pilot project. And for them to be able to use their discretion along with the professionals at the district attorney's office to say, this is not a person that's intent on pushing drugs into the community. This is a user, and we can help this person not only improve their own life, but also disrupt that whole supply that these drug dealers want to make available to the people in this Commonwealth. So I want to thank you for coming forward, for trying this out, for perfecting this model so that we can bring this to other places in this Commonwealth and perhaps to other places around this country. Governor Baker is in Washington this weekend with governors from all over the country talking about this very issue and how we in Massachusetts are perfecting a model that can help reduce the amount of exposure and combat this opiate addiction crisis that we all know is in every community of this Commonwealth. We have more work to do, so let's keep working as a team and working together until we fully eradicate this epidemic here in our Commonwealth. I want to thank the DA as well. DA Morrissey and his team represent a very dynamic and innovative office. I've read a lot about their Community Cares Kit and how they're helping victims and individuals that have been in families that have been impacted by addiction and opiate addiction. I want to thank them for really reaching beyond their official duties as a district attorney's office. The DA and I have had numerous conversations about ideas that he has, about things that we can all work on together, and I very much appreciate your leadership. And finally, I want to just comment on Quincy Drug Court. I've had the opportunity now several times to join the DA and some others in this room to the graduation ceremonies that exist at that court. And I want to thank the team, although they're not here today, for what they've been able to do to help divert individuals away from a criminal record and into a life that's healthier and safer here in this Commonwealth. So as you can see, we're in a city where this issue is fully embraced in so many ways, and I want to thank all of you for taking it on so aggressively because we have to. So with that, I would like to now turn it back over to Secretary Bennett and thank all of you for being here for this very important announcement.
I knew with the pilot program, I'd have to approach a forward-thinking district attorney. I've known DA Morrissey for 11 years, and when I came in and started to talk to him about the program, it wasn't just, we didn't come in and say, oh, this is the pilot program, this is what you need to do. We came in and said, this is the idea. And then DA Morrissey was the one who said, well, If you want to make this work in Norfolk County, if you want to help the people of Norfolk County, you've got to make this change and this change and this change, and you've got to tailor it to what we do here. And you've got to bring these communities in, and that's what's going to make it effective. And you've got to bring in Bay State. And it's because of what he's done, and because it's truly a partnership, and because he knows his county, his law enforcement, and his people, that we believe it's going to be a success. So now, D.A. Morrissey, if you could come up and speak to the group. Thank you.
Thank you, Danny. I have a couple of the law enforcement chief come up. Patrick, Chief Pace, Chief Grimes. The good and bad news is that for many years I served with a number of my good friends who are sitting here in the room, both mayors and the legislators, and really without your help and taking a chance on some of the programs that you have actually provided funds for and work with the administration, we wouldn't even be talking about this. But obviously it takes a lot of leadership from the administration and a buy-in on the part of the legislature to get people like me to do things that are completely outside of the box and outside of the normal, what you would expect, because people expect people to be locked up for drug charges. And in Norfolk County, the largest single killer of people in Norfolk County are people who are suffering from opioid disease. We lost 155 people last year, 173 the year before. And the Lieutenant Governor pointed out, I think a lot of that has to do with some of the education we're doing. I don't know that we're out of the woods. I think it was saving a lot more people because you've made Narcan more available. You've changed the law. The administration worked on that, which people thought we were crazy. We've made it available at drugstores, and you provided more beds for treatments. And the missing piece, Secretary Bennett was right. For us, I know that people who do my diversion, Peggy Krippendorf is here, and the people who do a lot of that work for us, we firmly believe getting people help is the best thing we can do. And I know that in the legislature and in the administration, that's their top priority, getting the right result. And it may not be locking someone up. And so when Danny says, not only is it a case of convincing me, but the case of convincing Pat's an easy one to sell, but the chiefs have all bought into it in their administration as well. We couldn't do it in these major communities at this end of the county. And day in and day out, we see some of the same people, and you say, what can we do? And the answer is take a chance on them, try to get them help. Now, ironically, we're asking people on the street level, police officers, to make decisions to try to get people into programs where they recognize need help, because they're going to keep coming back. That revolving door of justice is going to continue unless we do something different. And the administration clearly recognizes that. And I just want to make sure I thank Lieutenant Governor and the Governor for taking that kind of a chance as well. Make no mistake, there's a difference between a dealer and a seller and someone who is suffering from the disease. And that was the people that we were focusing on. And if I was to say also to take advantage of people when they may be most vulnerable, you figure that the police have now arrested their supplier. And so now they're wondering, what to do next, and where am I going to go and what's going to happen. So obviously, to take advantage of people when they could be their most desperate, the answer is yes, exactly what we're doing. We're trying to get them when they are the most vulnerable, when maybe we can kind of lead the horse to water, and you still have to get them to drink. And that doesn't happen the first time, because I've been reminded by Peggy, we've had a good numbers of, not large, but we think a good number of people come and buy into it. Some people haven't followed up, and some of the police have gone back and said, hey, we told you this is what you have to do in order not to get arrested. And so someone came into the court and didn't pan out the first time, and ironically we said, hey, you go back to Bay State and you work this out and get in the program, we'll still give you a break. And the answer is got to get them into treatment. And otherwise house breaks, everything that we see in Norfolk County, a lot of the assaults, the break-ins, the bank robberies, the chiefs will tell you, are coming from people with substance abuse-related problems, and it's our biggest single problem. So a person a week dies in a car accident in Norfolk County, high percentage drug and alcohol. That's our biggest problem. So I just wanted to say that, yeah, we are taking people, and they tell me in the recovery circles, it's often called the gift of desperation, because when you get to that point, you want help. And that's what we're trying to force people and get them to that point where we get them help. But I really couldn't do it without my partners that are here today, because they're out on the limb with me too. And arguably, we've tried a lot of different things. And if it doesn't work, trust me, the administration, the legislature, and the law enforcement committee will try something else. But we think this has some hope and some promise, and that's why it's a pilot program. And we hope that this works out, but it's only going to work if people work together, and these are the people. I have a couple of people who are going to speak. I know Chief Shaston is going to say a few words, and in fact, Lynn's going to say a few words, so.
Thanks, everyone, for being here. To be in the forefront of a novel program that's so simple is kind of perplexing for me. I view police as first responders to social ills, and oftentimes we use the court system as a corrosive effect, thinking we're going to get people into treatment. We know that there's a huge problem with that because a lot of the people don't benefit by being put into the system. The consumption of drugs is never going to go away, and this is a very thoughtful alternative. As a police officer goes, we are social workers with guns. We influence families, communities, and behaviors, and we're seen as a malignant authority figure in many of the communities. And when we deliver services to those in crisis that traditionally are seen as freedom restricting or something that's going to be negative in an outcome, people do not see us as benevolent. We are now, in this program, benign authority figures. We, as the gatekeepers and resource connectors in communities, can use this opportunity now to hook people up with treatment. Seeing someone on the street, as the district attorney said, a street intervention, catching people when they're at their worst, requires an immense responsibility, and we should be at our best. Why not be creative? Why not look at this person as a person with a mental health, mental illness, drug addiction, or other illness that we can intervene? We do it all the time with mental health issues. This in many ways is. So what we're doing is we're creating safer communities. Some will say, so you're just making a feel-good program. No, because the person we intervene with knows they're on notice, and we will see them again. And like we know already, many people, it takes multiple efforts. Families do it. Other community groups take multiple efforts and chances on people. There's no risk, a lot of reward. And for us, it's about time. It's about time. It's the right thing to do at the right time for the right reasons, and it makes communities safe. So that's why, as I speak on behalf of the mayor of Braintree and my officers, this is a great program, but it's not the only program. There are multiple efforts. So I just hope that people go back, take a look at what we're doing for this. It's a community building effort. It's delivering resources to folks that would necessarily not take advantage. And it's a very good feeling. I love saving lives.
I agree with Chief Shastany, obviously, that we're in the business of saving lives. And this is a great program. You're going to hear it all the time, it's a great program, great program. That's not just a stock answer. It actually is. The collaboration of the District Attorney's Office, my fellow partners in the departments that are represented in the pilot program, and our partnership with Bay State is only going to help all our communities. There's absolutely no doubt about it. We're seeing these people, as you've heard earlier, at their worst time, at their highest risk of overdosing again, once we take out the dealers. We're obligated to give them some assistance. I think we would be negligent if we didn't. This is a program that when we separate them from the dealers, they're going to be scattering looking for a new supply, which is going to be inconsistent to what they've normally had. So this is a great thing to give them that option, that they can try and go down the right path of a drug-free life and re-enter the community. And we will see some of that collateral crime dissipate, the car breaks, the purse snatchings, and the shoplifting and so forth. There's absolutely no doubt about it. And they won't enter the criminal justice system needlessly, because that's not where they need to be. They need to be in treatment. So as we know, relapse is part of this. We know that not everyone that gets one of these cards is going to actually go through the program, but we hope they do. We're not naive to think that everyone is going to go in. But what is the success? Someone's family member going in there and being able to go through the treatment and come out and re-enter their family. We do it with home visits where we try to heal the family. Now we're trying to heal that buyer out on the street. And there is a certain distinction, a definite distinction between dealers and buyers. There's absolutely no doubt about it. We're not soft on crime. We'll lock up the dealers every single day, and we will give compassion to some of the buyers in order to help themselves and get through the process. We want them back out on the street. We want them to follow that path. And I think our motto should be to have compassion for those less fortunate than ourselves, because they are out there, they need our help, and this program is going to blossom throughout the state and hopefully nationally. Thank you.
We just want to make sure that everybody appreciates how important it is. Our partnership with Bay State, they go back in this community to 1975 as Survival initially, and I couldn't have a better community partner in this region to be able to work with, because that was really what we were missing. Without the funds that was provided by the administration and the legislature, we had an empty hole, and Bay State really is filling that. And Pat said, we need to get people to the right place at the right time. They are a great partner. So, Mr. Secretary, you're up.
I just want to thank everybody and thank the people who are out there on the street and helping here at Bay State, doing the work on the front line. I appreciate it. Thank you very much, everybody, for coming.